Association for Continence. I'm here with Dr. Eric Rovner, Professor of Urology at the Medical University of South Carolina, and we're talking about finding an expert. What different professionals might be experts in diagnosing and treating bladder control?
You know, Leah, this has become a somewhat specialized field. There are urologists, urogynecologists who specialize in the treatment of pelvic floor disorders and urinary incontinence. But there's a whole host of other professionals, such as advanced practice nurses and pelvic floor physiotherapists, who greatly assist us in the treatment of these individuals.
How should a person go about finding and choosing an expert?
Finding an expert can be done a number of different ways. Certainly asking your family physician would be an excellent way. Speaking to friends or family who've had treatment is another way. These days, resources such as the internet can be helpful, but also can be somewhat misleading at times. So one has to have some degree of caveat emptor, buyer beware, when you start searching on the internet for an alleged expert. One must be very comfortable with their surgeon and doctor, and that comes from meeting your physician and asking the important questions that you need to ask to be comfortable with your physician. How many procedures do you do? How many patients do you see? Are you an expert in this particular area?
When should a patient seek different opinion or change doctors altogether without feeling guilty or giving up?
Leah, a patient has to be comfortable with their doctor. If they don't feel comfortable with their doctor, or they feel the advice that they're receiving from their physician is contrary to what they believe is correct, then they need to seek a second opinion. There should not be a twinge of guilt about seeking another opinion, and somebody should never have surgery or an intervention by a physician that they are not comfortable having take care of them.